Hi, everyone. Welcome to Research Showcase. My name is Diana Robles, and I am a board member as well as a certified educator in infant massage. One of the things I like to do when I teach infant massage is to talk a little bit about the research and what's available and what we know and what we don't know. And so I think that it's important to share research that we know about and give it to everybody so that they can have it to bring up in their own infant massage classes. So I'm going to be talking briefly about an article that I feel very strongly about, and I feel we don't talk about postpartum depression enough. So the article is from the Journal of Affective Disorders, and it is a 2008 article. It is titled Postnatal Depression and Mother and Infant Outcomes After Infant Massage. And it is from the Imperial College of Medicine. So that's good to know. It's a medical school article. So in case you've not looked at a journal for a while, or you don't remember, or maybe this is new to you, the abstract part of the journal is kind of like a real quick synopsis of what the whole article is about. So sometimes we can just look at the abstract and get what we need, but in many cases, it's good to skim it and kind of find other things that you might want to know about it. So that's what I'm going to give you today. And the abstract tells us that by attending baby massage, this journal or this research indicates that there's improved maternal depression and mother-infant interactions. The current study further investigated benefits of baby massage for mothers with postnatal depression and their infants. So that's really good to know. I think we all know that, but it's good to see it in a research study. The introduction piece talks about depression in general as being a disorder for which many in the general population seek alternative rather than conventional treatments. And they talked about a pilot study that found that attending infant massage classes shortly after birth reduces maternal depression and improves the mother-infant interactions to within the normal range. And a recent study re-emphasized the need to treat more than just the mother's depression in cases of postnatal depression. Now, honestly, postpartum depression is something that's very typical and does happen often. We call it the baby blues, and many women experience it, some do not. But just the fact that it could become more serious and even reach the level of postpartum psychosis is something that we should be concerned about and finding ways besides medication to support mothers. Sometimes that need to not take medication is very strong during that postpartum and nursing period. So the goal of this journal was to aim to investigate whether maternal mood, mother-infant interaction, and infant characteristics improved after these sessions with a follow-up with the infant at 1 year. So the methodology of the article was mothers that scored above 12 on the Edinburgh Postnatal Depression Scale, the EPDS, at 4 weeks postpartum were randomly assigned to attend baby massage classes. That was about 31 of them. Or they were placed in a support group, about 31 of them. Now that EPDS is normed for adult women and used commonly for postpartum depression. They completed that depression scale. They completed an anxiety and infant characteristics questionnaire, and they were filmed interacting with their infants before and after 6 intervention sessions and at 1 year. 34 non-depressed, meaning that they had 12 or less on the EPDS, were placed also in the study and involved in the infant massage classes. So the intervention was 1-hour infant massage classes were run by trained members of the International Association of Infant Massage. Each class began with a group discussion and then focused on different massage strokes demonstrated by the instructors on the dolls. The emphasis was on paying attention to your infant's cues and responding appropriately. All subjects are well educated, with 88% of the depressed group having been educated until at least 18 years, and predominantly white, 70%, and married or living with their partner, 87%. So you can already see one of the limitations of the study is that there's not a lot of diversity. But that means this is only one study. There could be many others out there, or we can start thinking about doing a study with more diverse populations. The results of the study that the more of the massage than the support group mothers showed a clinical reduction in EPDS scores between 4 weeks and the outcome. At 1 year, massage group mothers had non-depressed levels of sensitivity of interaction with their babies, whereas the support group did not. So those that were just in the support group did not have that. At 1 year, the depressed groups were still scoring significantly higher than the non-depressed on the depression and anxiety scales. There were no other differences in either the mother or the child between the two intervention groups. So primarily was the depression piece. So limitations, obviously for ethical reasons, the study did not include a control group of depressed mothers who did not receive any intervention, because that would be unethical. It is not possible to be sure that any reduction in depression was due to intervention, rather that maybe there was spontaneous recovery, although earlier studies found non-improvement in women with postnatal depression that did not receive any intervention. So just generally speaking, women who have postpartum depression and don't get intervention don't do well and do not have improvements in their relationship with their baby. So just to sum this all up, because you're going to use this potentially when you're doing a massage class, is one, it brings up the topic of postpartum depression, which I think is very important to talk about. But it also talks a little bit about the reduction in depression scores across the study period of almost a year. And the massage group did better on many areas. They also had somewhat better interactions with their infants at 1 year, a better relationship, which, as you know, that's a big piece of infant massage. There's no evidence to suggest that infant massage classes are in any way harmful. And as an intervention that is non-pharmacological, which means no medication, and includes the baby, it's practical, it's interactive, it's bonding, and it's often enjoyable. So in a nutshell, postpartum depression can be alleviated or supported or helped through this intervention. All right, good luck with all your massage classes.